Forget frequently asked questions.
Common sense, common knowledge, or Google.
How about advice from a real genius? 95% of people in any profession are good enough to be qualified and licensed. 5%
go above and beyond.
They become very good at what they do, but only
0.1%
are real geniuses. Richard Jacobs has made it his life's mission to find them for you. He hunts down and interviews geniuses in every field: sleep science, cancer, stem cells, ketogenic diets, and more. Here come the geniuses. This is the Finding Genius Podcast with Richard Jacobs.
Before we begin, a note from our sponsor. I'm Richard Jacobs, Executive Director of the nonprofit Finding Genius Foundation and host of the Finding Genius Podcast. In late 2016, I was rear-ended at 65 miles an hour by a truck on the highway, which sent me off-road into a ditch. The impact of the collision gave me a concussion and other injuries. At the hospital, a CT scan showed that I had thyroid nodules, which turned out to be cancer. It was then, when I had a biopsy of my neck, that I realized even if I was a millionaire, I wouldn't want a second or a third biopsy due to the pain and the invasiveness of it. And appointments at that time for thyroid experts were 3 to 6 months out. And I was worried about dying now, even if that was irrational. So because of this, I've decided to raise money to conduct a literature review on steroids, on the causes of anxiety and depression, a condition that affects well over 50 million people in the United States and hundreds of millions worldwide. Our goal is to create a codex, a guide that reveals all possible treatments for anxiety and depression for people that live with the condition, or for loved ones that have it, as my wife and my son do. To find out more about our fundraiser, visit findinggeniusfoundation.org and click on current initiatives. And now to our guest.
Hello, this is Richard Jacobs with the Finding Genius Podcast, now part of the Finding Genius Foundation. I have Dr. David Kendall. He's a senior global medical advisor at Zealand Pharma, and we're going to talk about peptide-based medicines and innovation and treatment of severe hypoglycemia. David, thank you for coming.
Richard, thanks for having me. Pleasure to be here with you.
Yeah, and I guess it seems like you've been in the diabetes area for, 40 years or so. Tell me a bit about your background and then how it led to you working with Zealand.
Yeah, well, I've been fortunate to have been a part of a pretty exciting almost 4 decades of innovation and discovery in the diabetes space. And for people who know diabetes well, they may know that this year marks the 100-year anniversary of the discovery of and the first use of insulin as a treatment for diabetes. So I've been around for a fairly significant portion of that. My career in the diabetes space, believe it or not, just started as a student worker where I was given an opportunity to work in a diabetes research lab back at the University of Minnesota, my medical alma mater, and really fortunate to have entered the diabetes space then. Probably prior to these 40 years, diabetes was still a bit of a conundrum. We did have insulin and a few other therapies available, but really over the last 2 or 3 decades, there's been an incredible era of innovation. And beginning from the 1980s onward, we had the discovery of and the use of things like recombinant human insulin, modifications of insulin, and then the introduction of literally dozens of other types of therapy to help care for people with diabetes. And you tie that, Richard, to a bunch of technological advances, things that now seem commonplace, like allowing people to test and monitor their blood sugar using fingerstick testing, to where we are today for a lot of people, particularly those with insulin-requiring diabetes, who use something called continuous glucose monitoring, which is a device that's placed on or under the skin. It's worn continuously and allows either your smartphone or a receiver to give you an estimate of what your blood sugar is literally every 5 minutes. So that's what's happened in the 4 decades I've been around. And as I said, it was really fortunate in many respects that I entered during this era of great innovation.
Yeah, well, tell me about Zealand. What kind of products are they working on?
Yeah, Zealand is a company that similarly has been around for literally decades, but a bit of a quiet player based in Copenhagen, Denmark. Zealand is committed to innovation in the peptide therapeutics space, as you talked about. And for people who don't know, peptides are the little proteins, typically the ones that our body makes and builds, that either are building blocks or are ways for the body to send signals and manage a lot of the internal functions. So things like the body's enzymes are, for the most part, peptides or proteins. Something I mentioned earlier, insulin, is a peptide. It's a bunch of these building blocks or amino acids that are synthesized and then put together and usually released by the body to go give signals to other cells and organs. And what Zealand has been committed to is taking a lot of these naturally occurring proteins or peptides and looking at them not just as ways to control the body's function, but to modify them in ways that they can hopefully be applied for the treatment, the management of human disease. And a couple of the very first that Zealand has brought forth have been modifications of naturally occurring proteins or peptides in the body. One is a peptide called GLP-1 or glucagon-like peptide 1, and many years ago, scientists at Zealand synthesized something called lixisenatide, which was a cousin or an analog of the naturally occurring peptide signal. That was ultimately out-licensed to a third party, Sanofi, and was developed for the treatment of type 2 diabetes. More recently, Zealand has been focused on 2 or 3 major areas, and that's the treatment of metabolic diseases, the most common or well-known of which is probably diabetes, but also what we call gastrointestinal diseases, disorders of the gut, stomach, and intestines that can affect people in various ways and lead to human disease. And most recently, Richard, what was developed was an analog of the naturally occurring peptide glucagon, peptide called dasiglucagon. And what glucagon does, for lack of a better term, is it really counteracts what insulin does in the body. Insulin is primarily a hormone that helps the body utilize energy, takes blood sugar from the circulation and drives it into cells to either be used as energy or stored. And what glucagon does is it counterbalances that and prevents the body from driving blood glucose levels too low. So glucagon counter-regulates or opposes the effects of insulin. Dasiglucagon was developed first and foremost as a potential treatment for episodes of more serious or severe low blood sugar called severe hypoglycemia, and was recently reviewed and approved by the U.S. Food and Drug Administration as an emergency treatment, an injection of dasiglucagon for the treatment of severe low blood sugar in adults and children ages 6 and above who have diabetes.
How does glucagon act versus glucose? Why not just have, pop some glucose tablets instead of glucagon?
Yeah, they ultimately hopefully achieve the same end. You can swallow some glucose, which raises the body's glucose levels. But in the cases of, say, more severe or emergent levels of low blood sugar, where someone may not be as aware or may have their ability to take in food impaired in some way, then glucagon given as an injection can help the body release its own stores of glucose. So again, in particular, in emergency situations, glucagon can raise the blood glucose level when taking in glucose tablets or oral carbohydrate may not be appropriate. And then, of course, if someone is either losing consciousness or has impaired levels of consciousness, having someone, a caregiver, give this shot of rescue therapy to raise glucose, which then raises their level of alertness or wakes them up, where they can then again take in carbohydrate or glucose tablets.
Oh, that makes sense. Okay. So this glucagon shot, is it in clinical use or where's it at?
Yep. So glucagon, the native peptide or protein that the body's made for literally millennia, was first developed, but it was developed back in the 1950s and 60s as a powder. So it had to be stored as a powder before it could be given as a emergency therapy, had to be mixed up with water, drawn back up in a syringe. So it was something called a glucagon emergency kit, which, while effective, obviously required additional steps. So what dasiglucagon and other what we call next generation rescue products allow us to do is to stabilize that glucagon molecule so it can actually be stored in the liquid form. In the case of an innovation brought forth by Eli Lilly, it was made into a powder that could be given into the nose. But to have preparations that didn't require all that mixing and preparation, dasiglucagon, the one I mentioned, developed by Zealand, can be stored in a refrigerator for 3 years in this liquid formulation. It's actually stable in conditions like room temperature for up to a year until it expires. So taking away some of the complexities of storage and mixing, and that's what dasiglucagon and newer preparations allow people to do, to have it at the ready should a severe low blood sugar event occur.
So what causes low blood sugar events?
Before we continue, I've been personally funding the Finding Genius podcast for 4.5 years now, which has led to 2,700 plus interviews of clinicians, researchers, scientists, CEOs, and other amazing people who are working to advance science and improve our lives and our world. Even though this podcast gets 100,000 plus downloads a month, we need your help to reach hundreds of thousands more worldwide. Please visit findinggeniuspodcast.com and click on Support Us. We have 3 levels of membership from $10 to $49 a month, including perks such as the ability to see ahead in our interview calendar and ask questions of upcoming guests, transcripts of podcasts you're interested in, the ability to request specific topics or guests, and more. Visit findinggeniuspodcast.com and click Support Us today. Now back to the show.
The most common thing is a mismatch between the amount of sugar in the body or the amount taken in and the dose of insulin that insulin-treated diabetes patients take on a regular basis. So if there's a mismatch, more insulin was taken than food was consumed, or sometimes if you combine insulin treatment with other means of clearing glucose in the body, like exercise, or there's a delay between when someone takes their insulin and when they can take in food, there can be that mismatch, which drives blood sugars first below a threshold we call level 1 or level 2 hypoglycemia. So to a point where the body isn't likely to get enough energy. And if that becomes serious enough, as I mentioned earlier, you can have things that go beyond just symptoms, the body not getting quite enough glucose, to impairing people's level of consciousness, ultimately leading to things like unconsciousness, even seizure, or in rare cases, death due to the fact that the body cannot get enough glucose into the system.
But does it ever happen for dietary reasons, or it only happens because people are taking exogenous insulin and can overshoot what they need?
Yeah, by far and away, the most common cause is that imbalance between insulin injections and other factors. But there are conditions, some individuals who undergo bariatric surgery, like gastric bypass procedures, can have low and even dangerously low blood sugars as a result of very complicated interactions between how food is taken in, how the body releases insulin. And there are other rarer conditions where hypoglycemia can occur even in the absence of diabetes and insulin injections. I think it's important to note, Richard, that there are other diabetes medicines that people can take by mouth for type 2 diabetes that can cause low blood sugar and in some cases cause severe low blood sugar. So insulin injections, the most common cause, but there are other reasons that severe low blood sugar can occur.
So what's the effects of hypoglycemia that's really severe? What does it do to the body besides the acute problems it causes? Long term, does it have any effect?
Yeah, you really hit on it, that it's the short-term problems that give people the greatest concern, because loss of consciousness, even seizures and other changes that can occur when blood sugar drops suddenly are certainly the ones most well-known. And while there's some controversy, people who have repeated bouts of low blood sugar, certainly it can be a profound disruption to their day. The fear of having another low blood sugar can, for some people, result in a lack of desire to keep blood sugars well controlled, something we try to do in those with diabetes. And at least in some selected cases, having repeated bouts of low blood sugar does have effects on both brain function, brain tissue development, and severe low blood sugar can also affect other organs. We know there's a higher risk of things like heart attack and heart problems in people who have severe low blood sugar, whether a direct or an indirect cause. So both short-term and some pretty serious long-term consequences can result from low blood sugars.
What about the effects of the glucagon shot? Are there any trade-offs or negative effects of it? And do people that need it tend to have chronic problems and need it multiple times in their life?
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
Yeah, so simple answer is when you give a glucagon shot to rescue from a severe low blood sugar, the most common effect is it raises blood sugar. That's why it was available too, and the newer therapies are now approved for the treatment of severe low blood sugar. But we know when given at the doses that are approved for that rescue therapy, that certain effects of glucagon, inducing nausea, in some cases vomiting, can occur. And that's really a consequence of giving these high doses as part of the rescue therapy. So things like nausea, vomiting, in some cases diarrhea, headache can occur from the acute shot or injection of glucagon. And then the other effect, obviously, is it can raise blood sugar, and blood sugar can overshoot. So in individuals who've had a low blood sugar event who take glucagon, often it not only corrects the low blood sugar, but can push it to higher levels, which in the short term is obviously the goal, to get it out of that dangerously low range. But patients who take it then will see a higher blood sugar, and it requires some balance and some patience to understand what those long-term effects are. And while glucagon is given for these rescue therapies, we don't really have lots of data on what happens when you either use it at lower doses long-term. That's something that's being investigated as a potential therapy to give a little bit of insulin and balance it with a little bit of glucagon or dasiglucagon in the case of our Zealand asset. But those are investigational uses. For people who've needed one shot, we know that people who have one severe low are at higher risk for having another one. So at the very least, they should have their rescue therapy on hand. But beyond that, the untoward effects of long-term use really aren't either well understood, but certainly there are not long-term deleterious effects that are common.
Oh, what about if an insulin pump could also include glucagon, so that if there's you don't want the pump obviously to have the person go back and forth, but in case it happens, maybe it should be incorporated so that the person can they don't have to go to the hospital or get an emergency treatment.
Yeah, absolutely. And it's what I alluded to, Richard. Having insulin in there is like having only an accelerator that drives glucose down. And then you have to back off on the insulin and hopes you have some balance in the system. But the body is, at least in part, designed to have multiple hormones sort of working in concert, and having insulin and glucagon or a glucagon-like molecule like dasiglucagon makes good sense. And I said this earlier, but we, Zealand, and many others are looking at what a bihormonal system might look like. And in fact, we at Zealand are working on so-called bihormonal artificial pancreas or pump systems that give both insulin and, as needed, can counteract that with small doses of glucagon in these dual hormone or bihormonal pump systems. One of our partnerships, the one that's most advanced, is in collaboration with a company called Beta Bionics. And Beta Bionics has developed a 2-hormone pump system where both insulin and a glucagon-like molecule, in the case of our partnership, using dasiglucagon because it's stable, can be put in this pump, is currently under investigation as a potential treatment for insulin-treated diabetes. So I'll emphasize that that's investigational, but something we are actively pursuing, looking at a balanced system, a dual hormone or bihormonal system, rather than an insulin-only system, as one potential treatment, not only to improve the control of people who live with diabetes, but to do exactly what you suggest, which is to provide a balance between insulin and glucagon.
I mean, would it make sense to also include somehow, administering glucose inside of a pump as well? Like, what if you would have glucose and insulin and glucagon, and you had an AI system or, machine learning system that would try to, I know they have to eat, obviously, but it would also be like a backup system that had all the tools necessary at its disposal to help somebody.
You've hit on something that a lot of people have both dreamed of and tried to conceive, which is not just using the hormones, but giving glucose or energy in a different way. That can be challenging, and there are none that I'm aware of that are currently under development using continuous infusions of glucose, but that can be done in rare conditions, for example, where the body oversecretes insulin in an abnormal way. Sometimes glucose infusion through the vein or pumped directly into the stomach through a gastrostomy tube can be used. The challenge there is glucose needs to be given in such large amounts and large volumes as opposed to very, very small volumes that are needed for insulin and glucagon. But those balanced systems, in the case of the two hormone pump system, using algorithms, which you called AI, is really part and parcel of that. The machine understands what the glucose level is, whether it's going up or down, and it adjusts the infusion of the various products, insulin, dasiglucagon, other things, in an attempt to not only prevent the highs, prevent the lows, but keep things in balance.
What's the future of Zealand's products? What's next?
Well, I mentioned it earlier, but dasiglucagon was recently reviewed and approved for the treatment of these severe low blood sugar events in adults and children, children ages 6 and above. That's where it was tested, and the FDA reviewed and approved it. That is something we call Zegalog. That's the brand name for dasiglucagon as a rescue therapy. It is approved for use in the U.S. And will be launched and available in pharmacies and to patients and clinicians within the next few weeks, here at the end of June and into the summer months. Beyond that, as I've already alluded to, we have a number of programs where we're investigating the use of dasiglucagon because it is stable in this liquid or aqueous solution. It can be used in pump systems, either the two hormone pump systems for the treatment of insulin requiring diabetes. And then in other rarer conditions, we have an active program in a rare pediatric condition called congenital hyperinsulinism. And congenital hyperinsulinism is a condition where kids are born and have excess or dysregulated amounts of insulin, and they suffer recurrent episodes of low blood sugar. Giving dasiglucagon as a continuous infusion is being studied, investigated as a potential treatment for that condition. All of that separate from the emergency use that I talked about that's already approved and will be available to patients living with insulin-treated diabetes.
Okay, and who should think ahead and find out about getting, this glucagon supplement or this glucagon shot? Should they have it ready? Like what kind of clinical conditions or what kind of issues, if someone has them, should they speak to their doctor and see if this would be helpful for them to have on hand?
Great question, Richard. And that's been one of the challenges in this area of low and particularly severe low blood sugars. Most people don't want to think about, nor is it always easy to plan for emergency events. This is much like epinephrine for allergic reactions. Many years ago, epinephrine was available, but it wasn't readily available to a lot of people with things like peanut allergy or severe bee sting allergies. But now, carrying typically pen devices that administer it can rescue people from those severe allergic reactions. Severe low blood sugar is no different, particularly in anyone who has insulin requiring diabetes, type 1 diabetes, or insulin treated type 2 diabetes, and specifically anyone who experiences even moderate levels of hypoglycemia, these so-called level 2 events, where blood sugars drop into the 50s repeatedly. And any individual who has suffered a true severe event where they needed the help of someone else, paramedics, a trip to the emergency room, family member to historically mix up one of the traditional glucagon emergency kits and give it to them. Anyone who's been in that circumstance, they're all advised to have a plan in place, talk to their caregivers, and have rescue therapy, whether one of the traditional kits or we hope going forward one of these newer generation rescue therapies like the Zegalog asset that I've talked about that was developed by Zealand and will be available soon. So those are the key characteristics of people who can and should be better educated, better prepared and can have an emergency rescue treatment like this available to them and their loved ones.
Okay, well, very good. Well, Dr. Kendall, again, let's restate. What's the website to find more about Zealand and your work?
Yeah, certainly to look at Zealand at zealandpharma.com. And as we mentioned, the approved therapy for the treatment of severe hypoglycemia is Zegalogue. That's ZEGALOGUE.com, Zegalogue.com. And, learning more about both what Zealand does and what we have available in our research pipeline, looking at peptide-based therapeutics and their application for the treatment of a number of health conditions, and more importantly, being aware of what is now available for the treatment of severe hypoglycemic events, including Zegalogue. So we appreciate your attention to this. And Richard, thanks very much for allowing me the opportunity to chat with you today.
Yeah, no problem. Thank you for coming.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
You've been listening to the Finding Genius podcast with Richard Jacobs. If you like what you hear, be sure to review and subscribe to the Finding Genius podcast on iTunes or wherever you listen to podcasts. And want to be smarter than everybody else? Become a premium member at findinggeniuspodcast.com. This podcast is for information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed.